52 episodes, 52 ordinary people, 52 real stories about things that affect overall health. Because there is a lot more that goes into being healthy than food and fitness. Inspiration, support, a new perspective, and knowledge. You'll find that and more here on the Health Ability Project.
Welcome to a special edition of the Health Ability Project. I'm Robin McKenna. I dedicated all 5 of this month's episodes to topics on women's health. We've discussed topics such as maternal nutrition, women's health equity, cervical cancer, and menopause. May is also Mental Health Month, another very important women's health topic. Here to talk with me today about mental health is my guest, Dr. Randi Wirth. Dr. Wirth is a training and supervising psychoanalyst and a fellow of the International Psychoanalytical Association, where she serves on the board of directors. She has taught and lectured both here and internationally. Dr. Wirth is in private practice in New York City, working with adolescents, adults, and couples. She is consulted on group dynamics and conflict resolution in schools and organizations, and has a special interest in ADHD, executive functioning in children and adults, as well as psychosomatic disorders. She has over 4 decades of experience in the field of eating disorders, having served as chief psychologist at the Renfrew Center and as executive director of the American Anorexia and Bulimia Association. Thanks so much for being with me today, Dr. Wirth. I'm so glad to have you, and I'm so thrilled to be able to talk about this topic today. Thank you.
It's a pleasure to be here, Robin.
Thank you. So, Dr. Wirth, when we hear the words mental health, I think most of us immediately think about somebody struggling or the imbalance of mental health. What exactly is healthy mental health?
I think that's a very good question. I actually think about that all the time. And in a simple way, I think it's knowing ourselves and knowing our minds and having a healthy way of understanding how our minds work and a healthy relationship between our minds and our bodies, being in sync, having those two things in sync with each other. And when they're not, I think about, how does that get in the way? And that's often what brings people into my office or my colleague's office when things aren't working and either symptoms appear that get in the way of having a healthy life, more long term. I'm not saying, if you're healthy, you can manage and tolerate different feelings that come up once in a while. But when it's, something that's getting in the way of having a life that you can tolerate, ups and downs and external stressors, then you handle those things very well on your own. But when they don't, and you have repetitive patterns that either from your past or things that appear later in your life, that's when I think mental health is something that your mental health is getting in the way of your having the opportunities for pleasure and, dedication to your profession, the work that you've chosen, your family, and yourself.
Mm-hmm. So it's not only about being happy, it's about being able to manage the rough spots that come up. And then also, as you said, being in tune with yourself. And if there's something more long-term or deeper, maybe working with somebody on how to manage that, the trigger points perhaps, or just having somebody to talk to when you're in a tough situation.
Well, I look at it in a very deep way. I know it's a very simple statement, but many years ago, Sigmund Freud, who is the father of psychoanalysis, had a famous response to the question regarding what is the core of psychological health. and a meaningful life. And his response was love and work and love being the cornerstone of our humanness. And, in many ways, I believe in that. Work is not just what profession you go into or, what job you have, but, what are you doing here on earth? What is important to you? What do you dedicate your life to outside of yourself? What gives meaning to you? And I think that's important for everyone, no matter what age you are. And if you don't have something that gives meaning, some sort of work in your life, then you have a hole or too many holes in your life, and you need to find something that is important to you other than yourself. And of course, love. That means different things for different people. It's not always a traditional love relationship, a marriage, a boyfriend, girlfriend kind of thing. It can mean, an intimacy of your choice. I am not traditional that one thing does it for everyone, but feeling of closeness and comfort with people that you trust, that you respect, and that is reciprocal, that people feel that way towards you and you have support in your life. Some people call it a community. For others, it may be one good person that you go to when you need to talk. So I think it's, different things for different people, but that what it's like inside, that you have that kind of intimacy and people to go to or a person to go to, and you're not alone.
Mm-hmm. What have you seen over the course of your career? You've been in this field for 40 plus years, and I would think there's
maybe 39.
Okay. Sorry.
38, 39. I started early.
What have you seen as far as the evolution of how mental health is addressed, how people are addressing it with themselves? Clearly, this isn't really the right way to say it, but mental health is having its time, right? It is no longer taboo. It is no longer a bad thing to say, yeah, I see a therapist, or I have a therapist, or my therapist said this. But there was a point in time not too long ago where societally we didn't talk about this. We didn't talk about our pains, our darknesses, if you will. What have you seen over the course of your career and how that's come to where it is now?
I would like to say that we were free to be open about that. And men and women would be comfortable saying, oh, I just started therapy, short-term, long-term. But actually, I don't think we've gotten to where I'd like it to be, that there isn't a stigma still attached to it. My education in my first Analytic Institute was in a major city. I grew up in Philadelphia, and then I moved to New York 37 years ago. And one of the first things that happened was a patient said to me, oh, yeah, everyone in my office knows I'm going to my shrink at noon. And I couldn't believe it, that it's in New York, it's so different. In Philly, you would never, say that. And isn't that wonderful? And New York is, a different kind of place. So over the years, I think actually I have found that more people discuss it with friends and even coworkers. Everyone knows that, Fridays at 12 o'clock, I'm at my shrinks. But I think in general, I'm on different boards and know people, nationally and now internationally. And I think it's different in different places, that there's still some shame attached to going to therapy. There are people who don't tell their family members that they would still feel that it means they're sick. They have a problem, that they don't feel comfortable with it, that people around them would judge them. So I don't think we're where I'd like it to be, that it's considered something that you go because a therapy relationship should be different than talking to mom, dad, a sister, good friend. And the reason is that people who love you have an investment in you, and it does affect the way they listen. People who are lucky enough to have good people in their life, I encourage that. I never am competition with that, but the therapeutic relationship should be different. If you have that, I should be able to listen in a professional way that is different than any other relationship because of my training. And it should have a beginning, middle, and end, because they're there for a different reason. And it's not to give them advice. It's to be able to listen and help them listen to what their words are saying, to get them to a level of understanding their minds in a way that they haven't understood before. And that comes from talking. It's that simple. Come to your session and say what's on your mind. And you can't do that unless a kind of trust in the professional and the right match with that professional occurs. And that allows someone to go deeper in ways that they often didn't ever expect to be able to do. And that's what makes, I think, talk therapy with the right person be a different kind of relationship and help someone go, further in understanding some of the conflicts that they had. Some that started early in their life, and maybe others that were more recent that get in their way.
Yeah. And, I guess, like you said earlier, you're trained to ask certain questions, treat the conversation a certain way. It's also a bias-free zone and a judgment-free zone, which you're not going to get from your best friend or your mother or your sister or your brother or your father, right?
Exactly. And what nerve it would be for me to say, I don't like the way this boyfriend, sounds. He's not, he's not right for you. I haven't met him. And who am I to tell someone that, he's not a good match for you, which I'm sure friends and parents who may be right. But my job would be to try to find out what the client feels. Why is this a pattern that she has had in other relationships, and why, and understand it for herself. Why is she in a pattern that she picks people who somehow she's repeating something that is not allowing her to be happy, to, get to where she wants to go for a life that allows her to experience, the full range of emotions and be herself, be honest, and trust someone, and be trusted. So, it's that kind of depth without my, even if I was to feel nervous or anxious inside, it would be, and hope that maybe she wouldn't end up with this fella, It wouldn't be for me to tell her. It would be for me to explore why I feel that way and keep it inside and help her get to her own exploration of why she feels the way she does over time, not be invested in the ultimate choice, but to also open up about how she got there and other things. For someone who comes in because they're stressed out about a job, the beauty part of talk therapy is allowing someone to move around in their mind and allow other things to come up, things that they may not have expected. And as I said, have the freedom to do so and discover things about themselves, their background, that, they may never have considered. I'll give you an example. In some families that were loving and caring and supportive, it's almost taboo to say anything negative about the family and to air their dirty laundry. So sometimes it's just a relief to be able to have something, quote, pop out, and for the first time and feel like, well, maybe it's not so dangerous to be able to, say something that, felt like it was aggressive and feel like that's okay, that it doesn't mean you hate your sister or, the sibling rivalry is something that is naughty and you shouldn't have it, but that emotions, are part of the human experience and they don't have to be dangerous. And they don't have to lead to conflict is part of the human experience. Right. And if you can talk about them and understand them better, there are actually ways to manage them inside for yourself, and sometimes even talk about it with the person in a way that it can lead to a deeper relationship.
Mm-hmm. That's great. That's a great example. Thank you. Have you seen over the course of time, is there anything different these days as to what the challenges are to balanced mental health versus 10 years ago, 20 years ago? Social media, I think of women in particular, obviously, because we're the caretakers, right? We have children, we help raise those children, but we're also the caretaker to parents or aunts and uncles, elderly aunts and uncles. So there's a lot riding on us on top of career and managing a home, et cetera, et cetera. I don't know that that's necessarily changed over the course of time, but maybe it's just become magnified. What have you seen? Pandemic, maybe?
Well, I certainly would start most recently with the effect of the pandemic. And I usually start from within and go back and try to understand that. But I really was blown away by the effect of the pandemic and the politics that we all went through since 2020, and the effect of regulations on us in a country that is not used to that, and being exposed to things in our government that were very aggressive and it felt very different than I think ever before. I think the isolation that we had to go through has had a major effect on people. I think people got used to working from home, and many people closed their offices, even clinicians, colleagues, and are having trouble when their companies or bosses are asking them to come back. That's fascinating to me. It's almost as though it's easier. They don't want to take the subway or, why should I spend money on that or cabs? I think that we're going to see a lot of issues coming from what we had to do because of this virus, and a lot of fears. There are people who are naturally anxious to the point of symptomatic. We all have anxiety. We don't, we're dead, and I'm not big on diagnostics. And even when people call themselves, I have so much anxiety, I'm not big on people labeling themselves and being identified with symptoms. I actually like to think about, who the person is and why they may be feeling depressed, what that's all about, rather than this identification with certain things. Yes, there are real mental illnesses that need certain kinds of therapies, sometimes inpatient therapies, heavy-duty medications, and I'm not in denial about that. But more functional people who, really define themselves by the symptoms, I try to move away from that. But quite frankly, suddenly having to deal with this COVID-19 and am I going to get it, and wearing masks all the time and being afraid of, do I have it? If you have the sniffles, going for testing, being afraid of, getting vaccines and having to ask people, changing your social life. I think that is a major change that we've all been through. And even though the WHO has made this ruling that it's over, it's not over, I think, in people's minds. And you know, it's a long period of time. And I think we're going to see the effect of that on external stress that came into our lives. So that's one response. I think the idea of women working and having professions, and I think whether you have children and have to make decisions about working or being a stay-at-home mother is very stressful for people. And, you know, I work with a lot of people who go back and forth about it, feel guilt about their choices, feel that the other could have been better, a lot of turmoil about what's right for them and how to negotiate, you know, being the best at whatever choice you make. And you know, negotiating that pressure from parents, pressure from spouses, the need for money, sometimes practical decisions. And I'm very interested in that kind of thing. I don't think there's one right answer that's perfect. I think that you need to actually find the answer that's right for you. That requires something very basic, which is separation and individuation. And it starts first from your parents, becoming a separate person, and what I call being launched by your parents. Your parents have to help with that. And you have to be willing to be launched and grow up. And that never means that you don't love your parents. You're not getting support from them and being, you know, having dinners with them and holidays, but that you find a way to actually separate and start a life for yourself, whether that is with, you know, another person and having a family, but on, you know, separate terms, that you're your own person. And I think when people have reached that level of individuation, it becomes easier to know, yes, I love to work and I get pleasure from work. And then I think it's easier to find whether you want to work full time and make sure that you have really good support for your child or children, that you've married someone or you live with someone that is also supportive of that decision, whether they stay home or whether you can afford to have good childcare or daycare, that you put things together so that, again, work, love and work, that things are in place so that your life you're doing what you want to do. You're contributing, not like a humanitarian to the world, but to yourself, that you're stimulated, you're doing things that you want, and you're not sitting at the park trying to play with your kid and unhappy. And kids pick up on everything. So if you're not happy as a mother, as a parent, you're not going to fool anyone with that. So I think it may be, you know, finding something, recognizing that, not being in denial that you made the wrong decision, being able to not live in that place, you know, recognize it. You know, if they're young and you need to make a compromise of doing something part-time or volunteer, something that actually gives you satisfaction. And at another point, you know, go back to school, find something that really you can sink your teeth into and gives you pleasure as an individual. That's very important. It's not for the money. It's really for you to feel when you go to sleep at night, you've been challenged, you like what you're doing, and you want to wake up in the morning and be a part of that. And also, this may sound rather daring, but that also has to do with the relationship that you're in. I'm a big believer that living in a mind filled with regrets, the shoulda, woulda, couldas, That's not a good thing. That's not a healthy thing to do. You can't go back in time. There's no time machines that you can go back or you can go into the future. Now is now. Mm-hmm. And you can change things if you've made a wrong decision, you didn't pursue something, or you picked a life, someone that doesn't make you happy, or you're, for whatever reason, you're not happy. That's a good reason to either go for individual therapy or, couples therapy, and explore it, and try to work on some things that have you stuck in life, in the present. It's only the present that you can make the changes in. Right. You can't change the past, and you can't live in the future. And some of the people who have been inspiring to me have been people who are in their 70s, 80s, even 90s, who are taking courses, who are always learning and never stopping, who get something out of their day or trying new things rather than living for that moment when they can. Mm-hmm. Never do.
Yeah. And it's, I think you said it in so many different ways during this conversation about feeding yourself and making yourself feel good about something that you're pursuing simply and exclusively for you. I think we all need a little bit of that. What do you think about the concept of self-care and its role in maintaining mental health? I mean, so many of us, we're just generally overly stressed out, right? And so, the spa days or some meditation or some yoga or whatever self-care is for any individual. Do you think it's a good thing? Do you think it's
essential?
Yeah.
And I think it often has a bad rap. It's, for the rich people who can go to expensive spas, but actually it's essential for mental health or for, not being, for your own health, and for being aware of, as I said in the beginning, for your mind and body to work together. You mentioned, I worked with people who have issues, eating disorders. Again, I don't like to label that because I think the first relationship in life is with food, with milk. Otherwise, we wouldn't survive. So I think everyone has some issues around that, and some people are on the continuum, have a disordered relationship with food. So I'll start even with that. I think that we have to know what we need, what portion we need, whether it's food, whether it's relaxation, whether it's sleep. One of the things that came to mind when you asked about things that I'm seeing now, I am more and more focused on sleep deprivation than I ever was in the beginning of my career. And it's almost out of sync, then, something who am I to start asking about how many hours of sleep do you have, or you look tired? It's not something that I thought was in my, my area, but, it would be more their physician. But I am known to ask, have you been to an internist or a sleep specialist? Because I think more and more when people are yawning in the middle of the day, or I find that they're up all night on social media and not sleeping, I realize how much that is affecting their mental health, their functioning, causing depression and malaise, and affecting their sexual life and, everything in their life, their distraction, whether they actually have ADHD or they are just distracted because they simply are sleep deprived. And it's affecting young children and adolescents. And I think it leads to self-medicating because, it's intolerable to not be able to get through your day, and people something as simple as just not being able to sleep. And a lot of people are on sleep medication. If it's actually anxiety and worry that is one of the main things that impacts sleep, unless you have sleep apnea or, a physiological reason that's causing it, that's a mental health issue. And you need to find out why it's impacting the hours that your body actually needs to sleep. Mm-hmm. So that's when I'll often introduce something adjunct to talk therapy. It's part of talk therapy, preparing for sleep, having a ritual of a breathing exercise, a yoga, a cup of
quieting down,
just almost having some time to be with yourself. Mm-hmm. and relax and give that to yourself. And surprisingly, it's very hard for people to do that. I think their minds are racing because it's almost feels indulgent to do that. And so that's something that's more frequently, on my mind, just to even ask the question, and then referrals for people, if I feel that they really need a professional to deal with that.
I think that whole concept of disconnecting and unwinding is becoming more and more impossible for us because we live in a world that is so connected. The 24/7 nature of social media. What do we all do as soon as we open our eyes in the morning? What do probably 90% of us do? We reach for our phone and we look at news, or we look at what social postings are going on. And it's just this lack of ability to disconnect. We somehow have to return to that.
Well, actually, I hate to use the word addiction and to that, but actually, I think it really feels when I go to a restaurant and I see everyone at the table on the phone, and it's social isolation, but
together.
Real people there, together. And it's sad to me. It's almost like, people are not talking to each other, not being together. And I think some years ago, the adolescents were seeing, they were doctoring their pictures, to look perfect, to look like models, to compete with, other people, and, to be liked and loved and attractive. And it's perfect. And that's impossible. I think people have to take vacations from their phones, which is really kind of sad. You can stay connected on an airplane. It never ends. And I think it's a real problem. And I think it's leading to the problem in the human experience. And with jobs that people are afraid they'll lose their job if they're not working 24 hours. As far as burnout is concerned, well, if you feel the pressure to hold on to your job, unless you produce at a level that, is perfect. And some people, they had to be perfect when they were 5 years old. They were preparing to get into Harvard, at a young age. And that would be an example of old patterns that they may be unaware of, but it continues throughout their life until they can understand that, they're the ones who have to recognize what's happening in them, and they have to take a look at that and realize they're the only ones who can stop it. Is it still so important? They got into the best school, or maybe they didn't, or they have a job, or they happy in that job, even though everyone else thinks it's bragging material. Aren't they happy? Do they want to do that? What's realistic for them if, in fact, it's only miserable to keep up with the standards they think are required to hold on to that job and either make that the money or whatever is attached to it, and assess, what pleasure is it giving them and what pain comes with that. So I think sometimes even short-term therapy to go in and talk to someone confidentially with neutrality and explore something like that, and have not necessarily to take action. I think this is really important. Therapy doesn't necessarily mean, at least the kind that I do, that you have to have an action plan and jump into making major changes. The change would be that you can at least take a look at your life and feel things and think about things, maybe expand your thinking. And if you're ready, or when you're ready, you may make some adjustments that bring more pleasure in your life and happiness, or maybe not. It's ultimately up to the person to do that, rather than an authority figure telling them they have to. But I think there's something powerful in the ability to at least talk about it and face it.
Right.
It's not easy, though.
Yeah. And that's a very good point to, that it is not an action plan. It's a process. It's a process about getting to understand yourself or learn about yourself and what triggers you, what doesn't trigger you, what the real why behind some of your behaviors may be, and how you might be able to correct it or heal it. And being able to do that in a safe space where there's no judgment, and confidential if somebody feels the need for it to be confidential.
It's always confidential. That's a very important thing.
So, well, I can't thank you enough. This has been an exceptional conversation. I really, really have enjoyed our talk today, and I think you have really provided some great information for people listening today. So thank you so much, very much, Dr. Wirth, for joining me today.
It was fun talking with you.
Thank you. Thank you. Listeners, if you like today's episode, please like us, share us, tell your friends about us, post on social media. And if you have any questions, comments, or suggestions, you can reach me at thehealthabilityproject@gmail.com. Thanks for tuning in, and we will see you next week.
Thanks for joining us today at the Healthability Project. We'd love to hear from you, so please email us your questions, comments, or suggestions, including future guests, to thehealthabilityproject@gmail.com. And please like us, subscribe, and share us with your friends.